First, let's discuss who gets milia. Milia can affect anyone, newborns, teens, adults. In adults, they're often triggered by use of heavy skincare products or skin that's healing from a procedure like a laser treatment or a peel. People with dry or sickened skin tend to be more prone to milia as well. Sun exposure can also trigger milia. It is important to note that not all milia look the same. Sometimes you may have just a single larger miliome, that's a single milia, a firm round bump that's very noticeable. Other times you may see a cluster of tiny white bumps, especially on the cheeks, jawline, or forehead. And that's sometimes called miliary acne or milk spots. However, I need to point out that many milia are not acne per se. So how do we treat them? Milia are treated differently depending on whether we're dealing with just a single large lesion or spot or multiple small ones. Single milia are best removed manually through professional extraction, and I will talk about that in a minute. As to the clusters of milia, smaller milia, they often respond better to treatments like microdermabrasion, light chemical peels, or topical retinoids that help improve skin turnover. So let's discuss those treatment options in a little bit more detail. For multiple small milia, this is what may work. First, gentle exfoliation with alpha-hydroxy acids or AHAs, and like glycolic or lactic acid, they can help prevent new milia by loosening these bonds between dead skin cells so they shed more easily. Then we have retinoids that are also effective because they speed up skin cell turnover. And also, it's very important to avoid heavy pore clogging products, especially around the eyes. Now, if you have larger milia, then the most effective treatment is manual extraction. And this is a simple in-office procedure. I use sterile needle to make a tiny opening in the skin right over the milium and extract the keratin. And some providers use a special comedone extractor that basically is the same thing to release this keratin plug. It's quick, safe, and typically leaves no scar when done correctly, but it's definitely not something that I recommend doing at home. In fact, I have seen a lot of scarring from our patients who are trying to do it themselves. The thing is that milia are usually deeper in the skin than how they look, than what you think. So please, again, don't do it at home. Infection, scarring, and ultimately failure of getting rid of them are the results or consequences of these at-home botched procedures.